Assalamualaikum guys, welcome back to my YouTube channel which is pharmacology. I hope that you all are doing good and well. So today we are here with another new topic of the pharmacology, which are the anti-Parkinsonism drugs. So what is Parkinsonism? It is a progressive neurological disorder of the muscle movement. It's a clinical syndrome consisting of four features: bradykinesia, muscular rigidity, resting tremor, and impairment of the postural balance, leading to the disturbance of gain and falling. Causes of the Parkinsonism are the idiopathic and secondary. Goals of treatments are the pharmacological attempt to restore the dopaminergic activity with the levodopa and the dopamine agonist. Restore normal balance of the cholinergic and the dopaminergic influences on the basal ganglia. Remedies for the Parkinson are the dopamine precursors, dopamine agonist, and mechanism of action of the inhibitors, and amantadine and anticholinergics. First of all, we have the levodopa or the carbidopa. It is the most commonly used effective drug in the treatment of the Parkinsonism, and it is a metabolic precursor of the dopamine. In the brain, levodopa is converted to the dopamine by the decarboxylation primarily within the presynaptic terminals of the dopaminergic neurons in the striatum. The dopamine produced is responsible for the therapeutic effectiveness of the drug in the PD. If the levodopa is administered alone, the drug is largely decarboxylated by the enzyme in the peripheral side so that little unchanged drug reaches the cerebral circulation. Peripheral dopamine decarboxylase inhibitors. In practice, levodopa is administered in the combination with the peripherally acting inhibitors of aromatic L-amino and decarboxylases such as carbidopa that do not penetrate the CNS. Inhibition of the peripheral decarboxylase markedly increases the friction of the administered levodopa that crosses the blood-brain barrier and reduces the incidence of the peripheral side effects. The most commonly prescribed form of the carbidopa levodopa is the 25/100 form containing 25 mg of carbidopa and 100 mg of the levodopa. Carbidopa does not penetrate the BBB blood-brain barrier, reduces the peripheral metabolism of the levodopa, increases the plasma levels of the levodopa, prolongs the plasma half-life of the levodopa, reduces the daily requirement of the levodopa by the 75%. Adverse effects are the long-term therapy leads to the wearing off phenomena. Patient may fluctuate between being off, having no beneficial effect from their medication, or being on but with the dyskinesia situation called an on phenomena. Mental effects like depression, anxiety, agitation, insomnia, hallucinations, euphoria, dyskinesia, excessive and abnormal involuntary movements. Peripheral, due to the formation of the dopamine peripherally, the most common peripheral side effects are the anorexia, nausea, vomiting, diarrhea. Cardiovascular effects are the orthostatic hypotension and the cardiac arrhythmias. Further, we have the drug interaction. Pharmacological doses of the pyridoxine vitamin B6 enhances the extracellular metabolism of the levodopa. Levodopa should not be given to the patient taking monoamine oxidase A inhibitors or within the 2 weeks of their discontinuous. Contraindications are with the psychotic patients, glaucoma, cardiac diseases, and the peptic ulcer. Dopamine agonists do not require enzymatic conversion of an active metabolites, not potential toxic metabolites, and 4 orally administered dopamine receptors agonists are available for the treatment of the Parkinsonism, which is ergot derivatives, bromocriptine or the pergolide, and non-ergot derivatives or as ropinirole and pramipexole. Their adverse effects are the dyskinesias, mental disturbance, anorexia, nausea, vomiting, postural hypertension, cardiac arrhythmias, peripheral vasospasms with the ergot derivatives. Monoamine inhibitors are A and B. First of all, we have the selegiline, which is an irreversible inhibitor of the monoaminase oxidase beta normal doses. It inhibits the monoaminase A and retards the breakdown of the dopamine. Tolcapone and entacapone, it inhibits the COMT, which is responsible for the conversion of the L-dopa into the 3-O-methyl-dopa. Amantadine, an antiviral agent, it enhances the release of dopamine from storage cities, and its adverse effects are the peripheral edema, headache, heart failure, postural hypertension, urinary retention. Acetylcholine blocking agents, it improves the tremor and the rigidity of the Parkinsonism but have little effect in the bradykinesia. Bipyridine or phenadrine, procyclidine, Acetylcholine blocking agents' adverse effects are the CNS effects like drowsiness, restlessness, confusion, agitation, hallucinations, mood changes. Atropine like actions, dryness of the mouth, blurring of the vision, urinary retention, nausea, vomiting, constipation, tachycardia. Withdrawal should be gradual in order to prevent acute exacerbation. The net result of all these medications is the balancing out of the acetylcholine, dopamine, and an improvement in the medication. So I hope to completely understand the anti-Parkinsonism drugs and what is the Parkinsonism disease. So if you understand it, go and like my video, subscribe my channel, and wait for other important topics of the pharmacology drugs. Take care. Allah Hafiz.